Hello, and welcome back to the Scenic View podcast. My name is Samantha Cline. I am the digital communication specialist and podcast producer here at Scenic, and I will be our host this week because our usual host, John, is out of office, which makes this week the ultimate girl power episode. Woo! Joining me today, as usual, is our executive director, Ardis Watkins, and director of government relations, Suzanne Beasley. Let's do it.
Let's do it.
Let's do it. If you listened to last week's episode, then you would know that Treasurer Briner was on, and he talked with us about some healthcare issues that are happening. He's talked about the Duke and Aetna transitions, as well as the ongoing negotiation with Duke, and also talked with us about the retiree system.
Yeah, it was a good interview. Treasurer Briner shared a lot of information. I think at the top of everybody's list last week was Duke and Aetna. There had been this ongoing, very public negotiation battle, for lack of a better word here, and that has all been settled. If you have Duke providers, you will still be able to continue to see your Duke providers. So that
got worked out, and he explained how that got worked out between Duke and Aetna, but it sounded like with a lot of participation and guidance from the state health plan to try to smooth that over. Obviously, our concern as a membership association representing folks in the plan would be that the plan doesn't overpay, because the treasurer was very public during those negotiations about the fact that if Aetna just gave Duke what they wanted, that money would then have to come out of the pockets of state employees and retirees the next year, because premiums would have to go up again without question, just over that one contract. So even if you lived nowhere near a Duke provider, what was decided there was going to dictate what came out of your pocket next year.
Yeah. And Treasurer Briner made a good point that everybody's not going to get what they want when they're going through these negotiations. And he went to bat.
Went to bat for us.
Yeah, went to bat for
members.
the people of the plan. And so you still have your Duke doctors.
Yeah. So we don't know exactly what they agreed to because, and we never make a secret of this, and we certainly were very open with the treasurer about it. We don't know what we pay any providers through our third-party administrator, Aetna. We didn't know what we paid them through Blue Cross before when they were the third-party administrator. And I don't know how you ever go to employees for premium increases unless and until we get to the point where we can know what we're paying them.
Yeah. And this is a taxpayer issue. These are tax dollars as well as employees. Employees are taxpayers too, and I think sometimes people forget that. But with this transparency fight, we've been at it for a very long time in the state health plan and the retirement system, and we're still not quite there yet.
Well, and Suzanne makes a good point. Sometimes the issues we're fighting for affect state employees and retirees. Sometimes they affect every single taxpayer in the state. And this is one of those, because if the health plan overpays, that health plan is in part funded with taxpayer money.
Right.
So every taxpayer is therefore paying more than they should. But it also hits taxpayers in another way, being that the health plan is 1/10 of the commercially insured people in this state. If the health plan overpays, it keeps prices higher for everybody.
Else.
So it's a double whammy on taxpayers if the health plan overpays. So again, we really want to see the secrecy around those contracts go away. And again, we were very open with Treasurer Briner. He knows that's what we want.
Yeah.
They're trying to insert more capitalism back into this process. It's kind of funny that capitalism in many segments of our government just kind of went away. And this is one of those, because if you have secret contracts, nobody's competing for anything, really. And so he's trying to insert competition back in there with Lantern. If you haven't heard about Lantern is a group the health plan would be working with that would negotiate with providers that meet their criteria for quality and who are willing to take a reasonable fee for the services. And so
for the volume of people that they would serve, that they would care for.
Yeah, they would get access to this big group of people in the health plan who, if they wanted to, because it would be voluntary on the part of members of the plan, but if members chose to go with a Lantern provider, it would be free to the members,
zero cost.
No cost. And then for these providers, what's in it for them? They might make less than if they're trying to gouge the plan by overcharging, but they would get volume. They would know they had a steady book of business there. So the idea is competition, use capitalism the way it's supposed to be used.
Scare folks with the Lantern program too, but I know I have had people reach out to me who are concerned that the plan was going to tell them who they had to see now, and that is not at all the way this is going to work. You can still go to your doctor for a procedure if that's what you would prefer and pay the in-network cost, but you could see a well-vetted Lantern physician and, see them for $0. So, win-win for the member.
Yeah, and we're going to have Thomas Friedman from the plan and Barry Weiss from Lantern, the company itself, on very soon to answer kind of more in-depth questions. This is a new concept to people. It's going to take a while. We'll have to talk about it a lot, I think, before people feel comfortable even thinking about volunteering to take part in that. But guys, it's those creative ideas and the ones that insert more competition back in this process instead of secret contracts and a way of approaching it that leads to more consolidation of hospitals and providers and less competition.
Something a little out of the box. So stay tuned. Be listening for more information.
But that brings us to the next negotiation. These negotiations between providers and insurance companies are constant. And UNC Healthcare and Humana are in one right now. We got a lot of calls on this week. So, Suzanne, I know you spoke with the health plan. Can you explain what does this mean if UNC says we're not going to honor Humana coverage anymore? Does this hit state employees and retirees, or retirees specifically?
The good news, if you are a state health plan member and a retiree on Humana, it will not affect you. The Humana contract with the state health plan is solid, in place. You are fine. Now, you got a letter because Humana is a huge insurance company and they have contracts with all kinds of providers. So instead of singling out like the state health plan and not sending letters to confuse everyone, they've sent everyone who has a Humana plan a letter. So please don't be alarmed and don't hesitate to reach out to us if you've got a question, but they are other plans that Humana is negotiating. It is not the state health plan Humana plan.
Come on.
I know.
They can separate that out.
There has to be a way instead of...
If not, I'm concerned.
Yeah, upsetting thousands of people.
I mean, considering how easy it is for us to separate how we send our emails, it's not that hard.
Surely Scenic's not more sophisticated than Humana. I'm doubting that on every level.
There's always some confusion, though, at this time of year, especially with open enrollment, because Humana, the insurance company, will send out information, and it's at the same time as open enrollment for the state health plan. So always look at any information you get from Humana for the state health plan logo to make sure that you're checking out the right information for you.
Well, this is obviously going to be nonstop, perpetually some hospital system will be in a dispute with some insurance company. Yeah. And this is just going to always be part of life. So we will keep you informed if it ever does affect you. And when it affects you, we will also jump in to put pressure because I think Treasurer Bronner explained this was really different with Duke and Aetna than we had ever seen before.
Yeah. We talked about how public it was for one thing, but it was a different level of negotiation. But again, if you have a Humana plan through the state health plan, you're a retiree, your plan is not affected.
From what I remember seeing from the limited, I don't watch the news a lot. I don't like the news. It stresses me out. But every time I would turn on my TV, the news would be the first thing that would come on. And they would be talking about the Duke negotiations and the difficulties that was going on there. And I don't think I've ever seen something like that so public.
I mean, look, when you're in a negotiation like that, one of your best things you can do is create a ton of fear.
Yeah.
People, I mean, the fear that people who have a real need for healthcare, not like I might need my healthcare, but they know they need consistent healthcare. Maybe they have a chronic condition. It's terrifying. Think that your provider that knows your situation, been treating you, maybe you have surgery coming up scheduled with a particular provider. That's terrifying. And
Yeah.
so it's easy. The more fear there is, the more pressure there is on the company you're negotiating with.
Yeah.
Yeah. I don't like it.
No.
That's all I can say about it. Every single time I turned on the news during that time or turned on the TV, it would just be them saying state employees might be getting screwed over by having another increase to their premiums because Duke wants more money.
Well, it's already state employees doesn't look like we're getting a pay raise.
Yeah.
So everybody's kind of going in the hole.
Yeah.
Now the premiums going up. The last thing they needed was.
I know they've got it settled now. So,
Yeah.
At the risk of piling on after they've got it settled, it was crazy making, however, to hear a really, really well financially stocked hospital system complain they might have to go into their billions of investments and take a little of that to keep going if they didn't increase the prices on $35,000 a year state employees who aren't getting a raise and whose premiums are going up. That's a hard argument to make that, some of our billions in investments, we might have to let go of those if we don't increase the costs on these rank and file people.
Sorry.
I think the thing that hit me the weirdest from a perspective point, it seemed weird to me, was that this had all become public right after they had just taken a vote to increase premiums. Are they trying to make our premiums go up?
Well, okay, so again, remember, there's an overlay of what's happening at the federal level that's kind of trickling downhill that I believe, and Treasurer Briner confirmed, is part of the issue here. Yeah. So states, in terms of their Medicaid dollars, they would expect to get a certain amount of reimbursement back for every dollar they spent. They would get more than $1 back from the federal government in terms of what they spent on Medicaid. That all changed after the big, beautiful bill. So now states, especially like North Carolina, who expanded Medicaid coverage, are having to figure out, so how do we pay that? And they're hundreds of millions of dollars in the hole. So Medicaid contacted providers and said,
sorry.
We're going to have to pay you a little less. Well, the minute I heard that, I'm like, those providers are going to go look for that money elsewhere. So the most obvious place is this huge state health plan. And sure enough, I think that's more the timing of it. It happened right after Medicaid, with the awareness from HHS that they were sharing with the legislature that what you gave us won't bridge the gap all the way, and we're going to have to go to providers. I think after that, a lot of providers made up their minds, I have to get it back somewhere.
Yeah.
So it just happened to be like a kind of coincidence that was the timing of it, not that.
I think so.
I think so. Yeah. And that's the reason I think there will be more of this. But in other health plan news this week, unrelated to cost, there was a federal appellate court ruling that led to the reinstatement of the North Carolina State Health Plan's exclusion of coverage for transition-related treatments sought by transgender patients. This goes back to, I don't know how many years old dispute over coverage for transition treatment. And there was a 2022 injunction against the state health plan, and that got vacated by the appellate courts, meaning they said, okay, we are no longer enjoining the state health plan from saying we're just not going to cover that kind of treatment anymore. So that's the other big piece of news that was, anytime there's a big piece of litigation out there against the health plan, that's something that we watch, because it can mean, it certainly affects, number one, costs in the system, but also the policies and how they affect state employees. You look confused.
Yeah. I am. I'm wondering if we can break this down into simpler terms so that I can.
So, there was treatments for folks who needed, some people call it gender-affirming care. I'm not always.
That's typically the
up to date
term that's used is gender-affirming care.
Yeah, and so for certain treatments for transgender patients, the health plan under Treasurer Falwell said, we're just not going to cover that now. And Treasurer Briner kept with that theory. We're just not going to cover it. A few years ago, a court said, we're going to stop you from saying you're going to quit covering it. And this court said, no, you can't tell them
that they
cannot cover it. In other words, this court said it's okay to exclude transition-related treatments from coverage.
Okay. So the appellate ruling is saying that
the health plan doesn't have to cover.
They don't have to cover it if they feel that it's
It's affirming what the plan had decided.
Right.
Yeah.
Gosh, I'd say it's probably been 5 years since.
At least.
Got it. I'm less confused now.
So if you have a little more history on this, the North Carolina case stemmed from the exclusion of transition-related medical procedures and medications from state health plan coverage that dated back, this exclusion, we won't cover it, dated back to the 90s with a 1-year exception where it was covered in 2016.
Interesting.
Yeah. So it is interesting. It was like this 1-year blip of coverage, and then there's been all this litigation since that time over the issue. Because you can imagine something's covered and then it's not. That usually gets people, upset. It's been, I'll tell you, I sat through health plan meetings where it was very emotional.
Yeah,
Testimony.
And listening to it
it's
at
a tough issue.
The General Assembly, there were open comment for the public. It was some really emotional stories. There are a lot of situations out there that are special situations in relation to that kind of care, and
that most people don't get to hear those stories. And when you do, it's really it's hard to be a state health plan board member. Honestly, it's a very difficult. These are volunteers, and they are hit with massive issues that impact people's lives in ways that, again, you wouldn't know until you heard from someone who's living it. And it was interesting.
As we talk about some of these issues, I question why anyone would volunteer for some of these things because it sounds so stressful.
It is,
and
but
so overwhelming
because these are important decisions that have to be made, and people who are dedicated to making them are.
I think it's just the anxiety inside of me that says that does not sound
Sammy,
like something fun.
In fairness, last week you said that a buddy comedy movie gave you anxiety. So, you don't need to.
They are both dying.
Oh, my goodness. I'm not over it yet, but I digress.
Didn't give me anxiety, give me nightmares.
That's even worse, but okay.
Keep moving. Let's see what other
we also have the Retiree System Board of Trustees coming up next Friday.
Friday after.
Following Friday. So the 30th, I believe. Yeah.
Yeah. So this will be the Retirement System Board of Trustees meeting where they will hear from the actuaries who will give their presentations on projections and where they think the system needs to go next. And, there's going to be some new information coming out to consider.
You just mean updated information on the investment performance or what?
Yeah. So the experience study that they do every 5 years, that's going to be included in their presentation. The projections on where they want to land with investments. We all know how important that is in relation to the retirement system. So they'll present all of that on October 30th. And then when the board meets in January, that's when they'll have votes and make decisions on what they're going to move forward with from the actuaries' report.
So retirees, I've gotten a lot of phone calls since last week's podcast with Treasurer Briner. They're very uncertain on even if the gains in the system, the investments did amazing. They don't feel like that money would come to them. They just didn't get the vibe that money was going to come to them. They're afraid that definitely the legislature would just say we're going to put less in for an employer contribution.
Yeah, so that always could happen. We'll have the stakeholders meeting next week where they meet with all the groups who have members in the retirement system, and we'll get to talk preliminary facts that'll be coming out. But yeah, it's going to be a while before we see any kind of investments in an amount that would pay for a COLA that would go back in the pockets of members of the plan. But I know y'all have heard me talk before about the ECRISP, the Employer Contribution Stabilization Rate Policy. So that's got to be revamped.
Tell everybody what ECRISP, what you said, what the letters mean, but what is it?
Yeah, it protects the employer, the state, from a certain level. They cap out what they're going to have to put in the plan. So that way, when you get gains back in the plan, those gains have to be used for other reasons, operational reasons within the plan. So there may not be, even though you got returns, it may not be in an amount sufficient enough to take care of the plan, after it's met the cap with the ECRISP, and then still have enough money left over to recommend that the General Assembly.
This is where people are kind of calling bull hockey on some of that. Yeah. They feel like you can play with that so much that you can always go, oh man, we did really well.
Yeah.
But we just didn't make enough to give you any.
We got a new fun word from Ardis right there.
What?
Bull hockey.
Yeah, you never heard that?
That's a good. Well, I mean, we've talked years, trying to break it down for people into something simple because it's so easy to get in the weeds with the retirement system and it's complicated. But, we try to break it down for folks. And I remind people that the way the system is built is the employer, the state contribution, your 6%, and then whatever the return on investments is.
Yeah.
And that money together, the system is built to provide its own COLA. When those gains are not there, that leaves us going to the door of the General Assembly, pounding on their door, asking for, the money to provide a COLA out of the general fund. And it's a ton of money.
But again, okay, going back to just same with the health plan, these are secret contracts we have with investment managers. And again, all respect to Treasurer Briner, and I know he knows the investment world. I would never know a fraction as much about the investment world as he knows. I do know this, though. I want to know what I'm paying for something if I'm paying for it. Now, with retirement, employees are more directly paying for it, not just as taxpayers, but as employees. They're putting 6% of their money in every month.
That's right.
Into these investments, the retirement system and its investments. And what they get in terms of information about those investments is nothing. If we're putting money in here at Scenic into our 401k, we can have the prospectus, we can have the offering documents, we know exactly what we're paying in fees. All of that legally is available to us. I still find it morally problematic, and I would think legally problematic, that employees who are putting in 6% every month out of their very own paycheck, in addition to their taxes that fund it, can't know anything about what's happening with that 6%.
And it's
it's their money. And Sammy's kind of looking, ERISA laws cover what you have to be told about your investments through your employer if they're like a 401k or something. There is not only not something like that for public pensions, the law, the way it's been interpreted is, there's a trade secret exception to the Public Records Act that makes it okay to keep these things secret. Most public money, you can't keep that secret. The public has a right to see what's happening with that public money. So, hey, Government Efficiency Committee, it's looking at so many things. If anybody hears it that's on that committee, Representative Torbett, Representative Kidwell.
Here's your subject.
Yes.
Here's your subject.
This is absolutely something that how can taxpayer money and directly employee money go into something and then it just be cut from the public? And we think this is okay. There's no transparency to that. None.
And the House Efficiency Committee, while we're there, they had their first meeting a week ago.
And sometimes people have
said, please add this to your list.
Well, sometimes people have said, but if we made it public, the deals we have with some of these investment managers, they're not going to want to do business with us. We have a retirement system worth over $130 billion.
They're going to do business.
Trust and believe. If they got to make half a percentage point or even a whole percentage point, maybe a whole couple percentage points less off of our $130 billion, they're going to do it to stay in the game with that kind of money.
They're still coming out on top.
Money confuses me in general. It really does.
Well, sometimes, though, things are made to be more confusing than they are.
They need to be.
You put it in,
it
gets invested, you should know where and how and what you pay for that.
Yeah. Moving on to the federal government being shut down. We haven't really talked about that. That went into effect October 1st. We've had 2 podcast episodes.
Yeah.
Haven't really talked about it.
Kind of had to wait and see where things are shaking out. I still think there's some of that going on. But
I mean, there's definitely jobs in government that will be tangentially affected. There's some positions that are partially federally funded. Now, so far, we have a situation where there's some positions being cut at the federal level, but not all.
Yeah.
I mean, all of them are frozen right now, but not all of them are cut. Just some are cut. The question is, how far do these cuts go? If you get deep, deep cuts in the federal government, some of those will have some overlay. Yeah.
Interesting.
But we still don't know a whole lot about it, but the longer it goes on, the more likely it is to roll down to the states.
DHHS met this week, Tuesday, actually.
The
state DHHS Oversight Committee, Joint Legislative Oversight Committee. And their first presentation was directly related to Medicaid and the possible scenarios on how that's going to affect the state, with the shutdown, with the lack of funding from the state in this last mini budget. And then in the afternoon, they had another session where there was a lot of Q&A between legislators and the leadership of the department. And yeah, it just very much felt like they were just trying to get a hold of what's happening, how they're going to handle it. I did think it was interesting. There was quite a bit of discussion about mental health hospitals. We've got over 300 beds that are, locked down because we don't have staff to run them. So they're just discussing, the things that Medicaid would pay for. And there was quite a bit of information that the department just indicated they would have to, circle back and provide because they just didn't have it at this time. So, yeah, I just think there's still some waiting and seeing where things are shaking out and what moves they're going to have to make at the state level.
And it has been, this isn't related to the federal budget, but it's been heartening to see the legislature talk more about that interplay between criminal justice reform or the criminal justice system itself and mental health investment.
Yeah.
Because I'm not taking anything away from what has been invested in mental health in terms of having a system and funding for programs to help people. But it was so neglected for so many years. It's going to take an enormous amount of money for that to catch up to where we need to be as a state.
Yeah.
And our population's grown so much. So I know the legislature's done what they had on hand and could in that scenario. But if we're going to solve the problem where mental health causes a certain amount of these more troubling issues in our criminal justice system, and especially people working in criminal justice who are not given proper training to know what to do. They come up on somebody and they don't know.
Well, and we've had conversations with our members who work both in corrections and, community corrections and DHHS facilities. And the folks that are in both of those areas, you're either in a prison or you're in one of our, hospitals here in the state. Some of them need to be in prison. Some of them need to be in the mental hospital that are in prison. And so you've got untrained employees in our residential hospitals here who don't know how to handle those, what is it? They call it the forensic.
Right. Well, and you also have just, like you said, community corrections out there. They're dealing with people. You've got law enforcement that deals with people directly, first line, meeting somebody. And they don't have proper training
and that's
to know what to do.
Investment. That's the state's just going to have to look to that.
Yeah.
So that's where we are on that.
Interesting. And we've heard that you have a little bit of gossip from the General Assembly about a possible micro mini budget.
Yeah, so it wasn't
micro mini.
That's what the conversation I had earlier.
Mini budgets
that are micro.
It actually was not a conversation with the legislature or any legislators, just some colleagues. But someone had heard that there was the possibility of a micro mini budget, which actually is not apparently getting a lot of traction with the, big subject matter of redrawing or drawing another congressional map next week. Well, what we definitely are hearing is that's going to be the focus of the legislature when they return.
When you hear micro mini.
Yeah, what is that even?
A pay raise that is enough just doesn't sound like it would be part of that micro mini effort.
Yeah, and then the conversation this morning was that, they hadn't heard anything of that directly affects us in that manner that would be included in it. But even if we see such a thing, it sounds like it's going to be doubtful with that big map on the table for next week. So
yeah. What are the details of that congressional map redrawing?
So from our understanding, it will be Don Davis's district.
Yeah, I think that's the only seat that's really
to draw him
play
out, which will help. Obviously, in Congress, preserve the Republicans' seats.
Yeah, so Speaker Hall and Senator Berger were public about wanting to help President Trump in his efforts to have a Republican Congress to carry out his programs, his policies. And so they mentioned California specifically. There was a little bit of a Twitter or X spat between Senator Berger and Gavin Newsom, the governor of California, this week over Newsom and the California legislature. I think, well, theirs has to go on a ballot for the public to vote. But California's response to Texas, Governor Abbott and the Texas state legislature, who had taken some districts that had been Democratic districts and made them Republican. California's response was, okay, well, we're going to put this out to the public and see if they're okay with us making some Republican seats Democratic. And so this is something we're seeing play out across the country where states are tit for tat and whatnot. And now we're in the mix.
Yeah, it's our turn. There appears to be a pretty hard line drawn in the concrete at the moment over a comprehensive state budget. So that's just appears to be less and less likely as we go along here. I do, however, maintain a little bit of hope. You know, when they were in session in August, they changed the adjournment resolution to allow them to be here for 4 days when they come back once a month instead of just the 2 days. So I was hopeful that they've allowed themselves some extra time to hopefully address, pay raises.
So, I mean, we've got a membership, Suzanne, that's all over the map politically.
Yeah.
I mean, we are. If you took our membership, they divide pretty close along the lines of how people register party-wise.
Yeah.
But they're collectively ticked off.
Oh, yeah, they are.
That there's no budget.
They are. Well,
so it's a weird thing. It's
frankly
something that's brought people together in a very fractured, in terms of a partisan, fractured world.
Yeah, regardless of which side you're on, you're not getting a pay raise right now.
And
so.
That's the bottom line.
That's
it. That's what they call a kitchen table.
That's it.
So if you're around the kitchen table trying to balance the checkbook and to get the bills paid, look, if we're not getting a pay raise, we're not seeing a budget, which is required to have a pay raise. It's like all of a sudden this is personal.
Yep.
So people's allegiance to their parties and all of that, I have noticed in the past year, at least among our members, they're like, look, all this other stuff aside, we need a budget.
Yeah. And we do. We need a budget.
So I'm not sure how many of them care so much who's in Don Davis's seat as they very much care
about sitting down and paying
why are we still sitting here wondering what's going on with us?
Yeah.
That doesn't help the way I picture it just being 5-year-olds, because now I'm just picturing them going to ask their parents for their allowance for the week and be like, hey, can I get my allowance?
Yeah. Well, that's why a lot of people say, oh, yeah, we need more unions. And, scenic isn't good enough because y'all have to collectively beg. You can't collectively bargain. You can't collectively bargain for public employees in this state anyway. Yeah. It's illegal, but have a collective bargaining agreement, that is. It's prohibited by law for public employees. However, it has been our belief as an organization that working with whoever's in control of the legislature and making the case as to why it's really just bad public policy and not good for all of the other things they want to accomplish if they don't pay people enough to keep them in these jobs. Number one, so the public has decent public servants because they need public services. You don't want them having the bottom of the barrel people who can't get any other job doing those.
Public service.
Quality. And then number two, it costs an enormous amount of money out of the state budget when there's turnover.
Yes.
It's not free to advertise these jobs to try to replace somebody in them. It's not free to train that person. That person doesn't walk in ready to do the job with no training. And in some positions, it's a considerable cost. So turnover costs are very real. They are, the last time that I saw a look at that was done was years ago. And at that time, it was $500 million a year just on turnover. That's dollar bills you're burning in a burn bin in your backyard.
Training ground for somebody to come and learn how to do something.
But that's wasted taxpayer money.
Yeah.
Going in, if I can't retain employees, it's going to cost a ton of taxpayer money. So there's multiple reasons, in our opinion, that the General Assembly has to work with organizations like us who aren't coming at it from a more traditional union stance. But when you say having to go and ask for your allowance, at the end of the day, that's what it is.
Yeah.
You have to go and you have to ask the General Assembly. You have to plead your case, make your case. But what the concern is what do you do when all of the facts, like what it costs for turnover, and the facts, like you get an inferior level of employee if you don't ever give them raises. When those arguments don't work, people are getting mad.
Mm-hmm.
So we're hoping the General Assembly will realize they need to show that they hear those arguments, and do something about it.
Well, I've been able to come up with another new visual in my head, but we'll scooch past that because Ardis, Tuesday, you were at the State Employees Credit Union annual meeting in Greensboro.
Yes. Scenic's own Amaka Flynn, who is a District 42 member of Scenic.
Longtime member.
Been around forever and is such a nice lady. And she will be an asset to the credit union. She has been elected to their board of directors. So congratulations to Amaka Flynn. Congratulations to the credit union for getting Amaka.
Yeah.
Like I said, she'll be a true asset to that board. We were thrilled to be able to see her win her election and become a member of that board.
And we posted about this yesterday, and she actually responded in a comment on our post, if you guys wanted to hear it.
Well,
very sweet comment.
Sure.
Said, "Thank you, Scenic family. I'm excited about this opportunity. Ardis and Brenda, it was wonderful to share this sweet moment with you. Thank you for your support." And she looks forward to speaking up and advocating for state employees and their families and making and supporting decisions that improve the economic mobility for state employees.
Oh,
Yeah.
that's very sweet.
She is a nice lady, and she truly will be great.
Yeah,
for
she'll be a great advocate for regular folks, which is good to have on the credit union board. And the credit union seems to recognize that, and they're embracing folks like Amaka who are ready to lead.
Yep.
So it's a win-win. Thank you to Lee Brady and everybody else at the credit union and on the board.
Yeah, and another fun little thing just before we get into our Gen Z Minute, the state fair opens today.
Yes, Ardis is stoked.
Favorite time of the year for Ardis.
It is.
Are you going this year?
Sam, I will go.
How many times?
It could be a monsoon every day of the fair, and I would go at some point. And shout out, by the way, to Commissioner Troxler and the staff at Department of Agriculture. And honestly, so many of the Department of Labor folks are so responsible as well. They have to make sure those rides are safe. And
and a couple of weeks ago, they started inspecting them on trailers. So.
Yes. Yeah. It's a huge job, and they have to do it so quickly. So shout out to Agriculture and Labor folks who are going to be working round the clock for this entire duration. But I'm definitely going out there. I will say there's two things in recent years that have been very devastating to me.
Mm-hmm.
Number one, I don't know if y'all remember the pig races.
Mm-hmm. Mm-hmm.
Those were the best.
Yes.
Those went away, I don't know.
Oh, no.
Those went away like 5 years ago or something. And then if you notice, I say about everything that it went away 5 years ago. It probably was 10. But now I understand another huge tradition, the Junior League turkey shoot. It's gone.
Oh, wow.
I heard there's a lot more food there this year, though.
Is there?
Well,
that's what I heard. I heard there was a lot more food and a lot more different, trying different kinds of foods that they'll have.
All I can think is, what if they deep fried now?
Right.
Can they deep fry an entire pickle for me? Because, you get pickle chips all the time, like fried pickle chips.
Oh, yeah, I don't
deep fry an entire pickle. That is what I want.
Somebody probably has that out there, I'm sure.
Giant deep fried pickle on a stick like a dang corn dog.
The big turkey legs are kind of tough to see.
That's one of my dad's. No, my dad's favorite thing is funnel cake. That's his favorite thing.
My son's favorite thing is the turkey leg, but it looks like sort of medieval people walking around just chomping on that.
Yeah, back before there was silverware.
Right. But
you wouldn't go to a Renaissance fair and get one as well.
I'm super sad about the Junior League turkey shoot because the son who likes turkey legs also won a turkey for the family a couple of years ago at that turkey shoot. So it was just a tradition for a lot of families for a lot of years. But,
so if you don't have those two things, what are you most excited for?
A Village of Yesteryear / livestock. They're kind of even for me.
I can agree with the livestock. My family, my parents would take me out of school for a day because my brother would compete. He showed sheep.
Oh,
and he would compete at the state fair with our school. And so my parents would take me out of school for a day and we would drive up for one day spend the day. We would go watch him. We would go do all of our fun
so much
stuff.
respect.
It's
for the
a
kids
lot of work
showing those animals. I mean, we sit in the bleachers and watch those, and it's a
commitment.
It is commitment.
Yeah.
Some of the students, it's their, like some of the schools, some of the students at different schools, it's their own sheep.
Yeah,
absolutely.
It's their own sheep that they have bought and raised. For my school, we had a barn at the school because there were students who didn't have farms that they lived on.
You had a barn at your school.
We had a barn at our school for our FFA kids.
We had an epic golf team.
And so we would, because I tried to do it one year, but I was also on cross country and I did sports and I did not have the time commitment to do both. So I had to drop doing that and just do sports.
Yeah.
Because I was already committed to that team. I don't know how my brother was able to do it both because
it's impressive. The kids that do that,
I
love all the livestock. But don't forget,
it was almost every single day he would have to go to school and walk the sheep. You have to basically train these sheep from babies to walk properly, to stand properly. You have to fix them and hold them in place. You have to shear them and take care of them.
Livestock better trained than my doodle. I mean, it's impressive.
It's a lot of work. It's a lot of work.
These kids are like in charge. I mean, it's great.
Yeah.
But I also want to shout out anybody that's got their produce entered in the fair because that's also impressive. Some of these pumpkins, massive.
Yeah.
Yeah.
And the gourds, North Carolina, there's a lot of great gourds.
Yeah.
Yeah, and here's something I haven't ever paid much attention to, but I have one of my best friends is a baker. And so she entered cakes this year. She won a blue ribbon.
No way.
For a wedding cake. Yeah, she shared that with me this morning. So I'm like, cool.
What's her name? Shout her out.
Yeah, her name is Carla Marbury, Sweet Juliet's Bakery. Everything she makes is made with love, and it's wonderful.
That's
My first
awesome.
question after she sent me a picture of the blue ribbon was, what do they do with the cake now?
I've always wondered that.
Yeah. I mean, because I'm down for a slice.
Unfortunately, I know what happens to those animals after those competitions.
Oh, no, I don't want to talk about it.
We're talking about cake.
Yep. We're not going to talk about those animals.
Well, the sweet little girl sheep, they go home.
Sammy.
So yeah, there's the state fair. There's the state fair excitement for the week.
Yeah.
Sheep and cake.
Well, we asked Ardis what she's most excited for this year. What are you most excited for this year?
Not going.
She doesn't like to go.
I don't go.
You don't want to bring the
I grew up going to the fair. The fair is wonderful. But
I was about to say.
I do. I have 4-year-old and 2-year-old grandbaby. So at some point they're going to want to go, and that'll probably change.
And Kittyland's pretty cool.
I mean, I don't want to miss those things. They're not little for long. So
yeah.
What about you, Sammy? I think it's food. Is my guess.
I mean, food is one of my favorite things. I think me and my brother, we just like to try the different things that are there because it's things that you can't just find in the store. So we'll also get ciders and try out the different ciders, seltzers and stuff that are local brewed or brewed across the state. I always like trying the ones that are brewed in the mountains because those are always really good.
Yes, they are.
So good. So many breweries.
I have
in
to
those
admit,
areas.
though, there is one thing in terms of new stuff. Some of the stuff in the Car Scott building every year, like the ShamWow guy. Nothing personal to ShamWow, but
really,
I've thought about a ShamWow. Sometimes I think I could use one.
There. People are like,
somebody will scoop it up.
Mm-hmm.
Yeah.
I like the free stuff. I like it when they have like random free stuff in different spots. I also like the rides. It's the one place that I can go once a year to ride the like G-Force spinny ride that just goes so fast that you don't feel like you're moving.
Yep.
Wherever John is right now, y'all can't see his expression, but this would be his expression.
Oh,
yeah.
It was. I don't even know how to describe what she just.
Yeah.
Ew.
Ew.
He would have made a funny face.
Yeah, he would have.
So, are we ready for the Gen Z minutes this week?
Lay it on us.
So, something that I found this week was a new research report that shows 7 in 10 Gen Zers believe that the government should do more to solve problems.
What does that mean?
It's mainly more talking about the fact that Gen Zs feel like we have less trust in the government.
But you want them to solve the problems.
We want them to. We don't think they will. We think they could do more to solve the problems.
But that sounds like wanting more government.
I don't think it's necessarily saying that we want more government. We want to trust our government more because it's more of a distrust of the government.
Hold up. But then the survey would have shown that they want to trust government more and not that they want government to solve problems.
Well, the same study reported that nearly 60% of the generation found it difficult to trust the government after the pandemic because a lot of the generation felt that they didn't do enough to protect people during the pandemic and they didn't do enough to keep us safe and how it was handled.
You guys had it rough during the pandemic.
Yeah.
Younger folks.
And so it just kind of means that in the future, Gen Zs are going to be less likely to trust elections, less likely to have confidence in the government, and less likely to approve of political leaders. We want them to do more to solve some of these issues, but it's not saying that we think they are doing more. It's more saying we think that they are not doing enough to solve some of these issues.
Well, the reason I was trying to drill down on that and understand it a little better is I think that's not just a Gen Z thing. I think there's a lot of people that they're driving down the highway and they're like, these roads.
Yep.
The government needs to do a better job of these roads. In many, many situations, why isn't the government doing something about this? And yet those same people oftentimes are like, we need to cut government.
Yep.
And so I find it fascinating.
Yeah, you can't have one without the other.
Right.
But...
Well, with that, kind of talking about it's not just our generation. It's saying more that our generation believes it the most out of the generations because the statistics that I have found from the survey, it's by the Pew Research Center.
Mm-hmm.
70% of Gen Zs say that the government should do more to solve problems, while it is 64% millennial, 53% Gen X, 49% boomers, and 39% of the silent generation in comparison. So they're just saying that out of the generations that are participating, the generation that believes that the government should do more to solve the problems the most is Gen Z.
That's probably, that would be good news for public servants.
Yeah, it would be.
Yeah. So
future is bright.
So that was my simple little thing that I found for our Gen Z Minute this week.
Thank you for sharing.
Thank you for House Gen Z.
I tried. And now it's time for our question of the week.
Sammy's wacky weird question of the week.
So our question of the week this week is, if a movie was made about you, who would play the lead, aka you?
So I always pick Stockard Channing. You know, you guys remember her in Grease.
She was the best.
Oh, she was.
She's a great actor. She was like a stage actress, like a very accomplished, trained actress.
And I loved her in Practical Magic too. You know, she's just a great actress. But there's some sass about her and the curly hair. Just feel connected to Stockard Channing.
I don't know if I have an actress that I feel connected to, but I have actresses that I've been told I looked like in the past who I'm like, okay, that person could play me if they wanted to.
Yeah.
I'd take it.
Who?
Anne Hathaway.
Yeah.
Yeah.
And Margaret Qualley.
Oh, yeah. That's Andy McDowell's daughter.
That's also Jack Antonoff's wife, who was a producer for Taylor Swift.
We knew it had to happen for no other reason than John's not here. And
no, I've gotten that quite a few times. I've gotten told that I look like Margaret Qualley quite a few times.
What?
The long brown curly hair with the blue eyes, I think is the main
good problem to have.
Yes, it is.
I like it. I think she's beautiful. She's beautiful. So I will take it. What about you, Ardis?
Sammy, I don't know.
Yeah. I'm not sure either.
Should we have Noah jump on and answer for you? Tell us who you
my son's hanging out in the studio right now. Noah, who would it be? I don't like the look on his face.
I know he's got something good in that head.
I'm thinking it, but I don't know if I should say it.
Go ahead.
You know who plays Joe on The Office?
Are you even being serious?
She's in a new show called Matlock.
Oh, gosh.
Kathy Bates?
Yeah, Kathy Bates.
Yeah.
She's amazing.
Okay. I'll take Kathy Bates in a second. I was thinking Julia Roberts, but we'll go with Kathy Bates' son. Sure.
Good job, Noah.
I was thinking Julia Roberts and I probably look alike, but yeah, Kathy Bates is probably a better fit.
I think I have someone for you.
Who?
Jane Lynch.
Oh, yeah.
Yeah.
Should be
And
good.
she's so funny.
Yeah.
Yeah.
That would be a good one.
She's so funny. Well, we let Noah in and ruined the girl moment.
We did.
It's okay.
Girl power moment,
You
but
know,
it's okay.
He was allowed in the studio to
It's
mess
I
with
will recede back to the shadows now.
Good to have you, Noah.
All right. Well, that is our episode for this week.
Woo!
Girl power.
Girl power.
Activate.
And we will be back with you guys next week.
Yeah, have a great week, everybody.